cannot recall the exact patient. But what I do recall is that after seeing them, I don't think they were terribly sick, is that they got a gift basket. And it was just kind of a funny moment. But it was amazing to be part of that on the first day, first shift, in a brand new facility with brand new people.
What it did to the people, I mean, people were showing up everywhere. When we had an open house, it was packed, man. I think the community wanted it so bad. We set up cases and showed people the instruments we were using, and man, that night, I thought it was gonna be a couple of hours. It went on forever, and it was fun. It was really fun, because everybody from the community came. And then we had a chef named Jason, and unbelievable. And this place became a place where people came to eat.
A number of years ago, I was asked to meet with two very key people, Dr. Al Picorni and Joe Tesh, and they wanted to talk to me about the notion of building a hospital in Summit County. And I said to them, but I don't know anything about medical care. They said, just meet with us, just meet with us. Well, that was a whole number of years ago, and I'm so proud to have been on the cutting edge floor of creating what's now this wonderful Park City Hospital.
I think we have kind of a unique population in our county. Where I grew up in Coville, it's a lot of old farmers, and now I'm just even seeing them out in the community. There are a lot of older people that need care that's close to home. They can't be always driving to the city. And so there's that population of like the old farmers, and then there's this new population of, they're really health conscientious, they're really active.
So what we found opening the hospital was that a lot of patients had to pay the toll. If they had an accident on the mountain, they would go through the mountain's medical assistance program, whatever medicine was available. Then they would come down to urgent care, and they would pay the toll at urgent care, and then they'd put them in an ambulance or a car, and they'd take them to Salt Lake where they would get care. Where now the accidents happen and the patients are brought to us where we can take care of their needs and not have to stop multiple times on the way.
There's something impressive about a corporation that comes to a community and actually listens to the community about what their needs are. We could have easily built a hospital cheaper, made it a white cinder block building and called it good. But instead, we came in and we listened. We wanted to make something that fit this community. And we were successful in doing that. We wanted to fit in. We wanted to show this community that we are part of the community. We're not trying to take over. We're just really here to support and care for the people that live in this community, because we live in this community.
A real growing experience, and I've really enjoyed being here. I've watched the hospital grow and expand and bring more patients in and bring more doctors in. It's just been a really good experience.
People, as I think one staff member said, that we have people that came from all different hospitals, all different care settings. So we all had our own experience, right? And I remember the first time we sat down as surgical services group, and before the doors officially opened, and we were talking about what needed to happen, what were our concerns, and everybody, well, where I came from, we did this. Well, where I came from, we did this. And it was interesting as we had all this experience, different hospitals, but still healthcare experience, how we then were able to put that together to be a Park City experience.
We were literally creating everything, making everything from scratch, like from ordering the right pots and pans to have here, silverware, setting up menus and recipes. Like, we had to start from scratch, and it's evolved into now, the kitchen is fully staffed and doing everything on its own, to now I work in outpatient. So now we have patients coming in to see nutritionists for any type of disease. So it's really expanded from like the bare bones of trying to build a department to now we have patients who are getting referred to us, and we're seeing just all kinds of people in the community for all kinds of needs.
Last time I met Dr. Rosenberg, I was the nurse that was working in the recovery room the first day, and his patient had come out, and he walked in and he did not have his scrubs on, and he didn't have a badge on, and I didn't know who he was, so I walked up to him and I said, "Hi, can I help you?" And he goes, "You're taking care of my patient." And I go, "Well, you don't have a badge on and you're not in scrubs, so I don't know who you are, so I'm going to have to ask you to leave." And he started to laugh. And he said, "I really appreciate that you're protecting my patient's confidentiality."
I love the people I work with. I love the pharmacy, my pharmacy group. We're like a family. It's just a friendly environment. Everyone's always saying hi. So I just love the atmosphere. It's just different.
2 years ago, I lost one of my daughters, my youngest daughter, and I feel all the support from my coworkers and my manager by that time, the chef at that time. I feel like they were part of my family, really. And later on, I get some health problems, and I feel the same way, like they're always on my side.
My coworkers are everything to me. And my patients are too. Like, I love my patients, and I love my job. Like, I feel so honored to have a job where I get to be in such a personal moment and such a time in their lives where nobody else gets to be there. They'll be like, "I just want my partner here," and then I'll be like, "Okay," and I already know I get to be there, so that's.
We had one case, patient came in from the ER, just standard, okay, bring her up. She had, a simple procedure, fix her, get her home. It didn't turn into fix her and get her home. It turned into life flight down to the city. It was way bigger than any of us anticipated. That was a crazy day. She came back 2-3 weeks later, and she came in and thanked us all. It was awesome.
I have a cousin that lives in Wyoming, and he fell off a roof and broke both of his heels. And a doctor up there told him that he would never walk again, that they just cast him and let him go. And my family called me, and I said, "Oh no," and I got him in to see Dr. Beals, and he got him scheduled for surgery. When he got here for surgery that day, he had left his CT scan in Wyoming, and Dr. Beals couldn't do the surgery without it. They wanted to possibly postpone it or cancel it, and I said, "Let me do a little bit of work," and the doctor's office got the insurance company to authorize a new CT. We fit him into radiology, and surgery wasn't delayed even by 1 minute.
I interviewed on the unit while it was still just a shell, no equipment, nothing in it, and I thought, all right, this sounds like a good place to move. So I came out all by myself and fell in love with the city, fell in love with my coworkers, the hospital, and this crew of people that I've worked with for 10 years now have seen me through many things, including a marriage and 2 kids.
I'm a Park City native, so years ago I would have never dreamed that we would have a facility like this, and even more that I would be part of it and get the opportunity to live and work in my own community where I was born and raised. That's pretty special to me to be able to do that and give back in such a meaningful way.
It is welcoming to see all the volunteers that come in. We live in a pretty healthy community, but it's nice to have that preventative and the live well piece to keep us healthy and to keep those future generations living their healthiest lives possible.
I love making braces. That's kind of what I'm known for. And some of my braces have made it to Olympic athletes who have competed in the Olympics in those. So that's fun to be able to cheer on one of the local hometown kids who's been a client and you've seen them get better.
Amazing of an experience it's been to have had the opportunity as a caregiver to start at a hospital from ground zero to now see where it's come in 10 years. It's just been really fun to see that growth and also to see, repeat patients coming back for, their 5th baby now.
I work with one of the most amazing teams in the business. not only are they professionals and have the highest level of expertise, they're nice and they care about the people that they're taking care of. It's just remarkable to be part of such a team. I think that's really important, and I think everyone here feels that and knows that, and I think the community knows that, and that's a huge piece of, that's why I'm still here 10 years later, because it's amazing to work here.